Welcome back to Creating Cooperative Kids. I'm your host, Bill Corbett. Why is reducing stress so important? Because stress isn't just problematic in the moment, it's a real health risk. The more stress, the more likely you will suffer physical ailments, from migraines to a heart attack even. But before you get even more anxious about the long-term effects of chronic stress, my next guest has some great ideas that include natural approaches to handling stress. Dr. Lisa Laughlin is a naturopathic doctor who specializes in stress relief and women's health. She completed her bachelor's degree in psychology at St. Michael's College and graduated from the University of Bridgeport with her doctorate in naturopathic medicine, as well as her master's in human nutrition. Now, Dr. Laughlin works with Dr. Skowron at the Harvest Park Naturapathic Medicine in Wallingford, Connecticut. Thanks for coming out tonight.
Thanks for having me.
Stress is a topic that everybody deals with, especially parents. Absolutely. And I am constantly talking to parents to try to give them some solutions. But when I can't help them with basic parenting, then I'm looking for you to send them to. So tell us a little bit about the difference between acute versus chronic stress.
Everybody is stressed. Like you said, nowadays stress is very common in our jargon. And acute stress is more of something that you experience day to day, whether it be a traffic jam or frustration with your kids or with your significant other, whoever. Chronic stress is when these things are every day, all day, with work, with home, and for a long period of time. And it's the constant pressure and the constant stress that can lead to issues, and it leads to an increase in your stress hormones.
So how do I know, how would a parent know if they're having chronic stress? Is there symptoms that they should be looking for?
Yes, so chronic stress is kind of sneaky. So over time, your stress hormones increase. So you can see chronic fatigue, problems with sleeping, so insomnia, issues with getting frequent infections, so lowered immune functioning, and even thyroid issues can actually be, the root cause can be this chronic stress.
And I'm concerned about that as a parent educator because the kids are going to be affected by it.
Right.
So I tell parents you're going to be a lot more successful as a parent, but you got to fix you first.
Exactly.
Because I always tell parents this kind of a weird thing that even though we cut the umbilical cord many, many years ago, it's still attached almost like a spiritual or emotional cord connection. And a lot of parents come to me and say, can you help me with this? How do I handle the situation? And in my clinical work, the first thing I do is ask the questions, okay, what's going on? And then I discover it's really coming from the parent.
Yes, absolutely. And oftentimes it is coming from you. So the better you can take care of yourself, the better you can take care of your children, especially when you have behaviorally challenged children or issues with a wide variety of things. It could be anything from a kid having a cold to autism with your children, and as if you're not taking care of yourself, you're not going to be able to.
And you know, it's not just parents; it's teachers too.
Yes.
Because when an adult is having challenging behavior issues, children can feel it. They can sense something's going on, and they don't know how to walk up to their parent and say, "Gee, Mom, something's going on with you. Can you relax a little bit because I'm feeling something coming from you." Same with the teacher. When the teacher's got a classroom full of children. And the teacher gets frustrated because the kids aren't behaving, the response oftentimes from kids to the chronic stress in adults is misbehavior. Because they don't know what's going on, they don't like it, and it actually kind of pokes them to start misbehaving and acting out. So what are some of the things that you do? Because I'm assuming, in the limited knowledge I have, naturopathic means you're trying to reduce taking medication from it. It's non-medicinal.
Absolutely.
Do you want to talk about that?
Yes. So we do focus on non-pharmaceutical interventions for anybody who's chronically stressed. The first step we usually take is measuring their stress hormone levels, which is our cortisol. And our cortisol is the highest in the morning, and then it slowly decreases throughout the day, and it's the lowest at night, and allows us to sleep. People who are chronically stressed, their cortisol is high all day and even through the night. They're having problems with sleeping. They have a shorter stick, so they're getting more frustrated more easily with a children, teacher, or a parent. You can see that. And so what we first do is analyze the stress hormones through saliva or blood, and then from there see if they need to either be their levels need to be brought down, or people who are in an exhausted stage need to be brought back up in order to, that chronic fatigue need to be brought back up, give them the energy and better handle the day-to-day.
And I would assume that a lot of adults aren't likely to just run to a naturopathic doctor. In fact, they probably don't even know, a lot of them don't even exist, right?
Yeah, yes.
So how did you get into this field? Just curious.
So I got into this field. I was lucky enough, my mother, when I was younger, I had a lot of asthma and allergies, and she didn't like the regular MD route. I was on too many medications. She didn't like it, so she brought me to naturopath and fixed my asthma, fixed my allergies, and so I was exposed to this side of medicine from a very young age, and I knew I wanted to be a doctor and help people on a deeper level, and not just, here's a pill for every ill.
So at Harvest Park,
Yes.
you focus on helping the adults.
Yes.
Non-medicinal solutions for problems and ailments. And then there are other experts like Dr. Skowron who works with the children,
Yep.
because there's many non-medicinal solutions. And unfortunately, we've been almost like brainwashed that we got to go find a pill for this.
Right.
There's always a pill. In fact, when you sit in the evening and watch television, we're slammed with all these ads that say, oh, here's a pill that'll fix this, here's a pill that'll fix that.
Right.
And then you listen to all the side effects. You know, it just makes you think, we're not supposed to be taking these kinds of pills for that. Is there a certain limitation as to what you can actually help with and things you can't? Is there a line that says, you know what, maybe there is a need for medicine, or?
At certain points, yes. I think it depends on how far because I specialize in more stress and endocrine and women's health, it depends on almost how far you're gone. So it depends on if you have gotten to the point where you're in an exhausted state, so you don't have cortisol, you're not producing it, and you're completely in a chronic fatigue state. That might be an issue where I would need some pharmaceutical interventions to at least get you to a place where we can start working. But most of the time, even at that state, it's easy to work with the patient and treat the underlying cause and get the patient back to where they need to be, immune system and otherwise.
So I have a question. What is
Yes.
cranial sacral therapy?
So,
Did I say it right?
yeah,
Okay.
sacral.
Sacral.
That's fine. Craniosacral therapy is a hands-on approach that works on our connective tissue. So the connective tissue is the glue that holds us all together. And when people are chronically stressed, they tend to hold tension in their shoulders or in joints, muscles, all throughout their body. And this can create chronic pain as well. So a lot of times when people are stressed, they have a lot of pain, myalgia, things like that. Craniosacral works to release these stress, these different places where we hold stress in the body, allow for better circulation, very calming effect. People feel better able to handle the stress of day to day, as well as just be able to actually relax and bring themselves into a relaxation, restful state, especially for parents who are teachers, constantly on the go.
So speaking of which, can you make any suggestions for our viewers who might be watching, where parents and teachers, things they can do on their own
Yes.
to reduce that? I'd be interested in hearing some more about that.
Yes, so one thing I always suggest, especially in an acute state where you all of a sudden you are feeling very stressed, is breathing exercises. So taking a second, pulling yourself away, taking a deep breath. You could do meditation, anything like that in a small state. Over time, it's very good to remember your lifestyle. So sleeping, eating, exercising, those things on a day-to-day basis are going to help your body handle stress. So you might have just as much external stress, but if you're eating well, maintaining your healthy blood sugar, eating the right things, exercising and sleeping throughout the night, your body's not going to have that response and have that bring your body into that kind of sick, ill state over time. We also treat with, multivitamins. High-dose B vitamins are really great for stress because they're water soluble. It's not too dangerous to have a high-dose B vitamin and a variety of other nutritional supplements.
I read an article in Time that told us some of those vitamins, because they're not really good, they're not soluble, that they really go through your system and don't really do anything. Is that true?
That is not true. Your body is quite wise, and so if your body needs the vitamin, it's going to utilize it. So even though sometimes you might be excreting some of the vitamin, it's most likely because your body didn't need it at that time.
So it can break down those tablets?
Absolutely, and especially if you get the vegetable-coated tablets, some of the the less filler in it, the better your body will be able to digest and absorb those vitamins.
What about breathing? That's important, right? Mm-hmm. I think we forget about doing that.
Absolutely. Breathing does two things. One, it calms you down very quickly, and two, it brings you away from the stressor that might be right in front of you. So you're driving down the road, there's an accident, you're running late, you're in traffic, everybody's been there. If you take a second while you're driving to just take a couple deep breaths, be aware of the air going in and coming out, you're not only removing yourself from the traffic, but you're bringing awareness to your breath, slowing your heart rate, relaxing your shoulders, and you're like, okay. It's all about breathing.
That's so important. Well, thank you so much, Lisa. Appreciate you coming
Thank
out. And we can all use extra tips on dealing with stress.
Absolutely.
So thank you for what you do.
I'll
be sending some parents your way.
Great.
Children respond differently than adults to the death of someone they were close to. Now, coming up in my next segment, we're going to learn what adults can do to help a child or teen grieve. So don't go away. We'll be right back after this short break.